Hi, everybody.
Hello there.
I'm Jerry.
And I'm Linda.
We're the Newcomers, as most of you know. I mean, that's why you're here, right? Because you know we are. And hopefully you got either my email shout out or Facebook. I just did a little live there. We did. And you've joined us. We have a really good show today. We're not going to jump right into it, though, because we have a special guest. And although she's here and waiting, we want to wait till the viewership builds up a little bit and we get some people on here. But welcome. For those of you that have not been with us before, we live in the Villages, Florida. And we're just living the retired lifestyle and sharing what we know. And hopefully it helps some of you along the way.
Yeah.
You are missing some pretty fine weather if you're not in Florida right now.
Oh, it's gorgeous weather. It's in the, I guess, 60s. This morning, it was like not even 50. They called and said, don't go to the water aerobics class because it's not 50 degrees yet. So they do cancel if the weather is not up to 50. So,
Well,
you know.
Would you want to go if it was 50 anyway?
I have my rubber suits or whatever they're called, scuba gear.
We thought about doing a show where we take a thermometer and go to the pools around here and check the water temperature because supposedly they're heated. Yeah. But boy, we went the other night and it was a little
cold.
Yeah, frigid. Yeah. So and we got a lot of people coming in now. There's Jay up in New Jersey. How you doing, Jay?
Hi, Jay.
Sydney, our loyal Sydney, Linda Wilkov, Thomas. Hi, everybody. Thanks for joining us. On today's show, we're going to talk to you about a lot of things, like we said, but mainly it's a show about Medicare. Maybe you're getting to be the age where you're looking into Medicare. Well, we have the specialist that's going to talk to you about it. First, I want to thank all of you that contributed to our Florida Disaster Fund. We had the GoFundMe. We had the meet and greet at Cody's. We raised $11,927, all of which, every penny is going to the Florida Disaster Fund to help folks that were ravaged by those last two hurricanes. Right. So thank you all for that.
Yeah.
And that was a good time. I was feeling poorly.
That was right in the midst of his leg injury. And, you know, he was wiped out when we got home. I was for sure, but I can't imagine how he felt. That was a long 2 or 3 hours there. It was, but it was so good to see everybody. Yeah. And Cody stepped up so great for us. Yeah. And anyway, good deal. Hey, I'm wearing my Notre Dame uniform. We play after a while. Yeah.
We play Army. We love Army. I pull for Army every time they play, except when they play Navy or Air Force or Notre Dame. You know, right. But Army, I'm so proud of those guys. But today, unfortunately, they're undefeated until today.
Army?
Yeah.
Until today, you said.
Until today. I keep having to lean over there because we're backwards on the camera here. Yeah. So yeah. But thank you all for coming in. We've got over 100 people now, which is nice.
That's good.
And we've got Laura. Hi, Laura. Lainey.
Yeah.
Patricia.
We got some old friends on there. Not old friends, dear friends. There you go.
Pat Smith is in Disney World, and she said it's cold over there.
Oh, but the sun's shining, right?
She didn't even know it, but I turned off the air conditioner for the last few days.
Yeah. No, I really haven't noticed.
And last night she said, could we turn the air conditioner back on?
Yeah, I got hot for some reason.
She got a little bit hot. Birds are flying south. We see those sandhill cranes. Some of them are always here, but now there's more. And those wood storks are here, and won't be long till those big old gigantic white pelicans come in.
I look forward to that.
Love those guys. And let's see, who was that? Kim asked about my leg. I'm feeling really good. I mean, I was just taking names and I was going to kick butt later, but now I can do it in either order. So it's good. We'll play some golf here real soon, see what happens. I think I can bike again. I don't know about my tailbone on the seat of a bike.
I don't think you're
That might be.
I don't think
But yeah, but thanks for all your concern. I'm doing great, but I'm not going to swim for a while because it's too cold.
Too cold?
It's too cold. Yeah.
Wimp.
If you have a lawn here in the Villages, you water that lawn. We're going to have to start watering more, believe it or not.
Is that right?
The weather's going to be cooler. The grass goes a little bit dormant, but we don't get those summer rains.
That's true.
And you know, we have a great deal when it comes to getting our grass cut. They cut $60 a month to cut it every week.
Yeah.
Until this time of year. And then they may cut it every other week and maybe in November. Yeah. Then they might go to once every 3 weeks in December and maybe once a month.
Yeah, but we still pay them to still $60.
We still pay them the same.
That's right.
Yeah, but so that's why it appears to be so cheap. But it's we really do appreciate those guys. I'm going to tell you what, we've had great luck with our landscapers, with our grass cutters, fine people, and All good.
Yeah. Hi, Elaine from New Jersey. How you doing?
Linda wants to know if you've started decorating your Christmas tree yet.
Yeah. Well, some people just skip Thanksgiving. I don't like to skip Thanksgiving. It has to happen after Thanksgiving's over. Then I start thinking about Christmas. I mean, the Christmas things were out during Halloween time this year.
Might interrupt just to tell Jim Neustadt that, all right, what are you trying to do here, buddy? Ruin my day?
Uh-oh.
I know that Northern Illinois beat Notre Dame.
Uh-oh.
The only blemish on an otherwise perfect season.
Oh.
But yeah, so we don't have anything up yet. In fact, she wants to buy a new Christmas tree.
I do. We had a nice new Christmas tree last year, but we had a couple limbs were broken, so we sent it back. That was really bad. We used it for Christmas and then sent it back. I felt like, oh, I was cheating, but I didn't want to have a tree that was broken. So they said, yes, send it back. So we did that, but we still haven't ordered a new one. So we got to get on that. It's not going to get here till probably the Christmas Eve.
Tom, our buddy Tom Drabchick has 3 decorated already. What's up with that?
Oh, Tom. Oh, we need
to get come on over,
Come
Tom.
on over, Tom.
All right, let's see what else we got here. We're going to talk to you about Medicare. Are you guys on Medicare? That's 65 and older, I believe. We're going to find out exactly all that in just a few minutes. But we have a specialist in the house, and her name is Renee DeVore. She's a licensed insurance agent for 14 years, and she specialized in Medicare for the last 10. Now, on my little thumbnails, I said we were going to have an expert, and she told me that's not the correct way to say it. She's a Medicare specialist,
Right.
to be totally
Compliant.
Yeah, compliant. Good word. So we're going to have her in here, and she is contracted with lots of companies. She knows lots of things about Medicare, and she's going to answer your questions. So if you'll type in your question, we'll get it. And we're going to have a call-in segment in about 10 minutes. We're going to give you our number. Are we?
Ooh, I have to go get that. When Renee comes in, I'll slip out and get our phone number to hold up. That's one thing I forgot to do. Shame on me.
And remember, when you call in, before you call in, turn down your TV or your phone or your monitor or whatever you're watching us on.
If anybody was with us the last live show, that was just almost hilarious.
All right. Well, Renee, can you want to come over?
Yay.
Just take your pillows.
I will.
And Renee will sit right here.
I will run and get the phone number. Excuse me.
Thank you so much for joining us.
Oh, well, thanks for having me. Appreciate it.
This is Renee DeVore. Like we said, she's a Medicare specialist. And you want to give them a little background real quick?
Sure. I have, as Jerry already said, I have been licensed for 14 years, specializing in Medicare the last 10 years. I have contracts with 14 different carriers, and I have to disclose I don't work for the federal government. I don't work for Medicare. I'm an independent licensed agent. On a personal note, I moved to the Villages 4 years ago from Illinois.
Yay.
I lived in the Chicago suburbs for 38 years. Got tired of the snow and said, it's time to go.
Yeah.
Right. And I belong to 4 social groups. There's only 4,000 groups here to join. Right. And
that's true.
Yeah. It's amazing. And I love to go to the polo games, play a little Bunco, little Mexican Train. And that's
Wonderful.
It. Yeah.
Did you watch us before you came down here?
Oh my gosh. Yes. I moved down here in the middle of COVID in October of 2020. I didn't know anybody. I didn't know how to navigate the Villages. And I watched you guys all the time, especially the first 2 years. And then the last couple of years, to be honest, just watched you intermittently because I got the hang of it, what's going on around here.
Well, you get busy, you get
involved. You get involved and whatnot. So very good decision to move here.
Well,
really enjoyed it.
Thank you for watching us. So many people do that. And who can blame them? You come down here, you don't have time to watch YouTube. No. You're out playing bocce and pickleball and bunco and
Mexican Train, but your information was super, super helpful. So I just want to put that out there.
Look at Linda right here. She's got such a small head.
I look like a little puppet back there.
Oh, jeez.
All right, let's start off with some questions. And now I'm going to tell you this. When I got to be Medicare age, I was fired up. This is going to be great.
Yes.
But I didn't realize when I went into Medicare, I was going to be paying a lot more money on Medicare than I paid before because I had a pretty good insurance policy. Mm-hmm. And they gave me a bridge from my retirement until my age 65. What is Medicare?
Well, Medicare is a health insurance program that was signed into law in 1965 by Lyndon B. Johnson. A little trivia for you there. And then Harry S. Truman was the first Medicare recipient. Just a little more trivia there for you. And it is a program. So you won't find a Medicare office anywhere, but you will find a Social Security office everywhere, all over the country. And they are the financial administrative arm of Medicare. And then who oversees all that is what's called CMS, and that is the Center for Medicare Medicaid Services, and they are the regulators.
Okay.
We have a question here that's going to come in, and we'll try to remember that. If you can remember that question, we'll get to it yet. It's a little bit putting the cart before the horse. So there's the question. That's from Traveler 07. It must be a secret agent.
Must be 007's on your show today.
And
Awesome.
Greg is there. Greg is the one that referred you to us.
Oh, yes, of course.
Very
yes,
nice.
I know, Greg. Of course, yes.
Okay, so some people look at Medicare as a handout, but actually it's not, is it?
No, you earn Medicare. So here's how it works. I always say the foundation of the Medicare house is parts A and part B. And you earn part A by working at least 40 quarters, which is a total of 10 years total. Okay. If you have earned your part A, you don't pay anything for it. If you've worked only 30 quarters, you pay $285 a month for it. And if you haven't earned it and you want to buy it, it is $518 a month. So that's quite a benefit that you have earned.
Okay.
Then there's part B, which is the other side of the, I say, the Medicare house, so to speak. And you will pay a premium on that your whole life, as long as you have Medicare. And it will be dependent on your income. So next year, the Part B premium is going up to $185. That's the base number. Okay. And then for higher income earners, there's something called IRMA, income related monthly adjustment amount. And there's income levels, and it's much higher premiums. It can go as high as $628 a month. Yeah, ouch. But most people pay that $185 a month.
Okay.
Yeah.
And if you're paying that $185, that's only for part A and B. Your drugs aren't covered.
They are not. So I think it's real important to talk about two things related to original Medicare, which again is A and B. So forgive my redundancy, but I repeat myself a lot that way. What's not covered under original Medicare are your drugs. You said it perfectly. Things like vitamins, things like dental, vision, hearing. That's a really big one. That's where I get a lot of surprise looks when I tell people that I work with. And things like long-term care, just a little bit is covered under long-term care. And if you have to go into assisted living, that's not covered by Medicare either.
Okay.
But what's real important to know, what is covered under Medicare are your preventative services. There's quite a few. Anything from your colonoscopies to your mammograms to PSA tests, etc. And I always recommend that you download a free app from Medicare called What's Covered. It's a free app. It's called What's Covered, and you can download it and you can put in there, is this kind of service covered, or is that kind of, and it's a very well done app.
Yeah.
And I've referred that to my clients for years.
Okay. What's covered?
That's good
What's
enough.
covered.
Very good.
Mm-hmm.
Write that down. I hope some of you have a pad of paper, because I think you're going to get some good information here. Now, for me, the big deal, when you reach that age, you start being bombarded with mailers.
Yes.
Oh, yes.
The people want you to join their Medicare company. Now, the government, you have Part A and B, but then there are either Advantage plans or supplements that you may or may not choose to have, right? If you don't have either one of those, you have to pay that large portion that's not covered by A or B, correct?
Correct. So A and B, that you have financial exposure unless you have anything beyond that. So I always give a couple examples if you don't, and we'll talk about supplements and advantage plans.
Okay.
But if you don't have anything beyond parts A and B, you could be paying as much as 20% of your doctor bill under Part B. You could be paying $1,600 deductibles if you have to go into the hospital. I don't say that to scare people. I just say that to disclose it because it's real important to know. Okay. Then beyond that, to fill in those gaps, as it's often called, you can either go with a supplement or you can go with an advantage plan, and they work very differently. So when I work with my clients, I spend a lot of time explaining the differences, because I don't do any applications for anybody until they fully understand what they're signing.
Okay. Well, when we got to 65 within 40 days of each other, Linda and I.
Uh-huh.
She's got a cold, she's coughing, so she ran in there to
Sure.
get a cough drop or something.
Sure.
But we had the big decision: do we take Plan F?
Mm-hmm.
And then Plan F was phased out right at the time that we retired.
Okay.
So we chose Plan G.
Okay. Very good. Okay.
And the reason we ended up choosing the supplement G instead of an advantage plan was we don't like surprises.
Okay.
So with Plan G, and you correct me anytime I say anything wrong, you have a set monthly fee. I think ours was $175 each or something like that.
Mm-hmm.
But aside from a small $250 deductible, give or take,
Mm-hmm.
we don't pay anything.
Mm-hmm. So no, everything you said was accurate. So, so yeah, you did good. You did good. Effective January 1st of 2020, you could no longer get the Plan F. That's typically what people had been going on for years. And so Plan G and Plan F and Plan C went away for people that turned 65 after that. So now the most popular plans are G and N is another one that my clients are looking at a lot more. And there is a monthly premium on those plans. It's based on your age, gender, zip code, and in some states whether you smoke or not. And ladies, you get a cheaper rate than the guys, just saying. Yeah. So, and that's how that works. And you pay a monthly premium on that. It does not include your drugs. And so I would suggest you get a separate standalone Part D drug plan, which you guys probably have,
Mm-hmm.
and that covers your medications. Okay.
When it came time for us to get a drug plan,
Mm-hmm.
we used an agent to help us.
Sure.
And they asked for a list of our medications because we ended up not having the same plan. She has one and I have a different one.
Sure.
Because mine covered my medications and hers covered hers. Some of you folks, like John, I see there is writing a question. If we don't get to your question here, we're going to call in just a minute, and you can ask that to her and find out the answer. But John's question was, could you just tell them briefly the difference between Plan G and Plan N?
Sure. So Plan G, as Jerry said, covers everything but an annual deductible, which is defined under your Part B of original Medicare. And that price is going up to $257 next year. So it's annual. And I've had people say, do I have to pay that every time I go to the doctor? No, just once. So pretty much figure the first time you go to the doctor on your plan, you're going to get a bill for that annual deductible. Okay. And then everything else is covered unless you go out of the country. And we probably should talk about that because this is a big cruise area.
It is.
Every time I talk to somebody around here, they've gone on a cruise. So, and then Plan N is a much lower premium. But here's the other side of that equation. There are copays when you go to your doctor, $20 copays. If you go to the emergency room, it's a $50 copay on that. And so you need to be aware of those differences because you don't want any surprises. That's the biggest thing. When you go on Medicare, you do not want surprises. So whomever you work with, whether it be me or somebody else, please get into the detail of what you're signing up for. Okay.
Yeah. With the Plan G,
Mm-hmm.
we pay the big deductible, $250 a year, whatever it is. It's something like that.
Mm-hmm.
And then after that, there are no more fees
Mm-hmm.
except for your prescription drugs, which you have a different plan.
Correct.
Plan D. Who's your Plan D through? Aetna?
Yes.
Aetna, and I have Centerwell Pharmacy for mine, and it works really well. And they all have an outlet locally that you can get your drugs if you need them in a hurry. So that's what we do with that.
Mm-hmm.
But the Advantage plans, that's when you come here, if you go to one of these meetings in the villages, you're going to see tables set up and they're going to give you koozies and they're going to give you combs and flashlights and everything else and tell you that they can give you free coverage. Plus they can give you a free drug plan. Plus you can get a free membership at at the
at the health
you
clubs,
know, at
through
the health
Silver.
clubs, and
A new
that's
golf
an
cart.
advantage. And
And
you
you got
get-
a new golf cart.
so that's without paying anything. What's the downside?
Yeah, so I just want to back up a little bit on the supplements and the drug plans, if I will, and then I'll
Okay.
jump right into the advanced plans. So, because you brought up a really good point, you're on one drug plan, Linda, you're
Yeah.
on a different one.
Mhm.
Once you go into Medicare, and I work with a lot of couples, once you go into Medicare, no longer you are two people on one group plan, right? You are treated as individuals when you go into Medicare. So it's very common when I work with couples, they're on different drug plans. With supplements, there are some benefits to be on the same supplement, however, because there are household discounts associated with that. Okay, so just wanted to share that. Advantage plans work very, 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 very different than supplements. I say they're a pay-as-you-go kind of plan. They can be that you can free. If somebody's telling you it's free, it's not. There's no such thing as free. But it can be a low or no premium on those plans. They are divided into HMOs and PPOs, and it's very super important before you go on those plans to make sure your doctors and any other health provider you want to research is in that plan, because the last thing you want is to go to the doctor, give them your health insurance card, and the doctor's office says, we don't take that plan. And that is, again, that's where I spend a lot of time with my clients. Give me a list of your doctors, all your medications, because I'm under the same HIPAA laws as doctors. So I'm comfortable asking that information. And then it's a pay as you go. So you can, even though you might have a no premium plan, you're still going to pay things like going to a specialist. If you have to go into the hospital, typically the first 7 days, you have a copay every day. An ambulance ride, there's a copay for that. Blood work, I'll keep it short and sweet, but that's pretty much how it works. So you want to really look at on these plans what's called a MOOP, MOOP, maximum out of pocket, and you want to see that's where you're protected and where you quit paying. You're not nickeled and dimed to death. That's in my clients' terms. They say that to me all the time. Oh, good. I know I've got a MOOP. I've got a maximum exposure on that, right? And then where you get a lot of advertising. I mean, they're on TV every 5 minutes now because we're an annual enrollment period. But anyway, they do include additional benefits like the dental, vision, hearing, which is not covered in original Medicare. People like those benefits.
Yeah.
You mentioned the health club memberships. That's some of those plans include that too. But there's a lot of market disruption on those plans next year, which we can talk about when you want to. But I want to just kind of give people a heads up what to expect on those plans for next year.
I'll tell everybody, we have AARP, United Healthcare Plan G. And what we looked at was our maximum out of pocket. And yearly, it's 200 and some bucks, plus all of our premiums,
Sure, it
paying
is.
our premiums.
That's on supplements.
But if we had gone Advantage Plan, I saw, and you can correct me if I'm wrong, but the company I was looking at, you could basically have $10,000 out of pocket.
You could. You could. Yeah. And you really want to take a look at that. And I can't go into details of plans or insurance carrier names because this is education only right now. But what I do with my clients, they sign what's called a scope of appointment, which says we talk all things Medicare, fully disclose all the cost, everything to them. But you're right. You could have a maximum out of pocket that high. Yeah.
And Triple Q has a great question. Is it true once you go on an Advantage plan, you cannot change to a supplemental plan?
No. So here's how that works. So when you first turn 65, you have what's called guarantee issue rights. And you can go out there and you can pick any supplement that you want. You don't have to answer any medical questions whatsoever, and nobody can decline your application. And so that's how that works. So if you go on a Medicare Advantage plan right away, or you choose to go on one later, with a Medicare Advantage plan, you have a 12-month window of time to get guarantee issue rights back to a supplement. And I've done this for a couple of clients, back to a supplement with no medical underwriting. And then your Medicare Advantage plan would be canceled out as soon as you sign up for a drug plan, because drugs cancel out drugs no matter what plans they come from. Okay. Did that answer the question? Hopefully for him. So he has the right 12-month window, trial right to go back to a supplement. If you're outside of that window, then this is what a lot of agents will not tell you. Then you can't go back to supplement unless you go through medical underwriting.
Well, we've had friends that like to travel and are snowbirds, and they found that it was harder to be a traveler on Advantage plan than it was to be on a supplement.
Well, traveler in the States or outside of the States?
Even within the States.
Okay. So once you are on an Advantage, if you're on an Advantage plan, as I mentioned earlier, you're on HMOs and PPOs, which is network driven, as we know. Doctors contract in those plans, and they're filed by county. Once you leave outside of your plan, it's a little harder, yes, unless it's an emergency situation. So if you say you're here in Florida and you're visiting family in Arizona, for example, and you fall and break your ankle, go through the emergency room door and you will be treated as if you are in network. But if you're visiting family in Arizona, in my example, and you want to go in for your annual exam, you're going to be out of network and not covered. So all your primary care you want to have done in your network, emergency can be done outside of network.
Yeah, with our supplemental plan, what I really love is there are no copays. When you visit the doctor, when you go to a specialist, even when you do a televisit, you go to the emergency room, there are no copays.
Correct. And so when you're on a supplement plan, the question you want to ask your healthcare providers is, do you take Medicare? That's all you have to ask them. And 99% of the time, they're going to say yes. The only time I've heard of people being told no is that there's that exception where doctors, if they're maxed out on the amount of patients, called panels. So if doctors have, usually their panel size, meaning their patient size, is around 2,500 patients.
Wow.
If they're maxed out, they're going to say, no, we can't take you as a client. And they would, I'm sure, would refer you to somebody else you could go to.
Okay. Let me grab our telephone number and
Okay.
I'll hold it up here. And remember, up here it's written, but you can't see it. Turn down your volume before you call. 352-571-9749.
And
Give us a call.
And I heard turn off that football game too. That's what I heard.
Yeah.
What football game?
You're not watching TV, are you, Jerry?
7:00 tonight.
7:00, you'll be glued.
There you go. Yeah.
If you have a question, give us a call.
I wanted to talk about this while we're waiting on a call, if that's okay.
Sure.
Or it says, fortunately, from Laura. Hi, Laura. I'm not on any medication as of now, but I know I will need a Plan D drug plan. So here's what I see happen quite a bit. People, when they're 65, hey, I'm not on any medications, or I'm on one inexpensive medication. And eventually the day will come, if you live old enough, you're going to have to go on some kind of medication. If you do not enroll in a Part D drug plan when you're first eligible, you're accumulating a penalty. And that penalty will carry with you through the rest of your life. So,
Oh, my goodness.
so a Part D drug plan protects you from that penalty.
Right. So if you're healthy and you turn 65 and you don't pick up a drug plan, you're going to pay a big penalty later if you decide you need it.
Yes, you will. Yes, you will. And it's not, it slowly creeps up on you because it accumulates a little bit every single month. And then people get surprised going, why am I paying X amount of dollars?
Yeah.
Right.
All right, Linda.
Okay. We got a call.
Hello there. Are you on?
I guess we missed that one, but
I'm
please
sorry.
don't hesitate to call back.
I apologize.
No,
If
you're
you-
fine. Should I move that closer to me?
Well, they're going to hear the voice out of the speaker there.
Gotcha.
So yeah. So
Well, please call back.
Lots of questions here. There you go. There's a call.
Hello there. You've reached Jerry and Linda. What can we do for you?
Hey, this is Mark calling from North Carolina.
Hi, Mark.
I have a question that I just turned 65 a couple months ago, and I signed up for Medicare. However, I am still covered with insurance from my wife's job. So I didn't sign up for anything extra other than Medicare. Just explain when I should sign up for any supplemental plans or parts?
Great question. I run into this a lot. People that are on their own group plan or on a spouse's group plan. And what you can do is you can stay on, in your case, your wife's group plan, and you can suspend paying your Part B premium, because that'll save you, as you heard the numbers, at least $185 a month. As long as you're on her group plan, you're on what's called creditable coverage. I'm going to spell that because it's kind of a weird word we don't use every day. CRED, like David, IBLE, creditable coverage. And so when you are ready to come off of her group plan, then what you can do is you'll have a special enrollment period off of that group plan, and that is called an SEP, special enrollment period. You'll have to fill out what's called an L564 form, and that connects the dots to give you guarantee issue into a plan coming off a group plan. Did that help?
I think so.
Roger, I have a question that might help you. If he signs up for Medicare now, though, he's going to start having that deducted from his Social Security, right?
Right. So if you're on Social Security, it'll automatically come out of your Social Security check. Otherwise, you get billed quarterly. Have you signed up for your Part B right now? Have you signed up for that?
I don't think so. I'm not on Social Security yet.
Okay. So have you signed up for your Part B on your Medicare yet? Hopefully not, because here's two reasons why.
So.
Okay, so hopefully not, because when you sign up for your Part B, what that does is that initiates your window of guarantee issue. And if you don't need to sign up for Medicare, you don't need to sign up for Part B yet, because you're on your wife's group plan. And it's a waste of money, really, to sign up for that Part B.
There you go. Saves you a little money, Roger.
Mm-hmm. Yeah. So if you have signed up for Part B, don't feel bad about that at all, because people do that because it's confusing. You can go to Medicare and say, oops, I really did not mean to sign up for Part B. I am on my wife's group plan. I want to delay my Part B, and they can cancel that out for you, and you can re-sign up for it again when you're ready.
Well, is that going to be on my Medicare card?
You're on your Medicare card, which is your red, white, and blue card, as I always call it. There'll be a Part A effective date on there, and that's the month of your birth. So I just turned 65 in October. So my Part A effective date says October 1st, 2024. And then I'm not going on Medicare till January 1st. So my Part B effective date will be January 1st of 2025. So you want to look at the effective dates on your Medicare card and see what those are.
Okay, my card says hospital Part A.
Yep. Mm-hmm. Mm-hmm.
9/1/24.
Right.
And it says benefits only.
Okay, and then there's no Part B effective date on there, is what you're telling me, correct?
Right.
Mm-hmm. Okay, that's good. So you don't have to sign up for Part B. You can stay on your wife's group plan, save yourself that monthly premium, and then when you're ready to go off her group plan, then you go apply for your Part B and then go from there.
All right, very good.
Okay, sorry, it took a little while to get there, but yeah, apologize for that.
Thanks so much for calling.
All right,
bye-bye.
Thank you. Laura,
yes, we have been happy. We've had several doctors, and we've been happy with our doctors through the AARP plan. Here's an interesting point.
Okay.
A 90-year-old father was hospitalized 5 times and in a nursing home rehab center 3 times. She was able to switch him from Advantage to original Medicare with no medical underwriting.
Okay.
Oh, good.
So, see, let me reread this, make sure I answer this correctly 5 times.
By the way, we're just here for information, and we get your final answers from your professional.
Right. So you can leave an Advantage plan. He can do that when you're hospitalized in a nursing rehab center. And there's a number of rules around that I'd have to ask you some more questions around that. But that is possible. Yes.
All right. We missed that call. Please call back if you don't mind.
Okay.
No, but you had to answer the question. So you're doing really well.
Okay.
Bye.
Does the wife have to sign up for Medicare if I'm still working and she's on my insurance?
No.
The wife.
The wife, the spouse, as long as she's on your group plan, correct? So she can, as long as it's what's called creditable coverage through your group plan, she can wait. And when you retire, she can go off your group plan, as can you, and you'll both have guarantee issue for a special enrollment period coming off of a group plan.
All right, give us that call. Here's the number again. 352-571-9749.
And thanks for the coaching. I got to look up on the green dot because I'm not used to being on live broadcast here.
Yeah,
so
it's
thank
the
you.
little green
That's
dot.
that little green dot. I was
That's
looking right
it.
there. Thank you.
It works.
It works. Yeah. Yeah.
All right, let's look through here. There we go.
Hello there. Who are we talking to?
Ralph Taylor from Seattle.
Hey, Ralph.
Wonderful.
How's it going?
Going great.
Bob.
Got a question?
Hey, I got a question. I'm going on Part B next month,
Okay.
December 1st.
Okay.
And we're going to be traveling a lot between Seattle and the villages. Probably be there a couple months of the year.
Mhm.
I don't have hardly any medical bills. I see the doctor once a year, healthy. I've got one prescription that's very cheap. I mean, if I bought it outright, like $15. So my question is, should I go on a supplemental or should I do an Advantage plan?
It depends. That's a whole long conversation, but I will tell you how this works in either situation. If you go on a supplement, especially people that travel a lot. I have a customer, they have 5 homes or they have 2 homes or whatever. They go on supplements because they have the flexibility of going anywhere they want. Just like Jerry said earlier, supplements cover all 50 states. So you don't have to go through networks, get referrals or anything like that. If you want to save some money on premiums, then definitely you can go with an Advantage plan. You want to pick up those additional benefits and an Advantage plan. So it really is a very personal decision based on costs and how you're going to use your health care. So I can't give you a real straightforward answer until, we go through all those details with you. But in general, if you're going to be living 2 places, is that what I'm hearing you say you're going to be doing?
Yeah, we'll be down there probably a couple months out of the year.
Snowflake.
I got grandchildren out here in Seattle, and I can't get Mama to leave, so I think that's our best bet.
Yeah. Yeah, it's in general, for something like that, probably a supplement would work best for you as long as it's in your budget. And if not, if you go on a supplement initially and you do want to change on a Medicare Advantage plan between October 15th and December 7th of every year, you could leave your supplement plan and your drug plan and go on a Medicare Advantage plan if you ever wanted to do that, knowing that you have a 12-month window of time to go back to your supplement if you don't like the Advantage plan. So even though this is a federal government program, there is some flexibility in how Medicare works.
Hang on 1 minute. We have to.
I'm sorry. Go ahead.
I've got to figure out how to delete some guy.
Oh,
Okay. Well, like you, Jerry,
Don't
I'm
worry
thinking
about
about the
it.
AARP United
I
Healthcare.
haven't seen it. I can't see it here.
And I thought I heard you say your premium is like a couple $100 or so a month.
Yeah. First of all, you'll have 2 premiums, one for Part A and B and one for your supplement if you have it. And combined, those for us are about $350 combined.
For both of you.
Yeah.
Yeah.
Well, what could I expect to pay on a drug? Is the drug Part D?
Yes.
Yes. So because this is an educational only conversation, I can't go into specific dollar amounts, but here's what I can tell you is that drug plans can vary in price. There's a monthly premium on drug plans. There could be drug plans that have no premiums on them. Okay, so you want to explore that.
Mm-hmm.
And the average national this I can share. The average national cost for a drug plan is $38.76. Okay, so
yeah, and would that even make sense with my drug being $15 a month?
So I would suggest you go on a drug plan. And here's why. Because when you're eligible to go on a drug plan, if you do not go on a drug plan, you're in the background, you're accumulating a penalty. And then when you eventually go on a drug plan, that penalty has been accumulating, and Social Security, who manages Medicare, will tell you, hey, this is how much your drug plan penalty is, right?
Okay.
Now, if you're a veteran,
Right.
are you a veteran by chance, sir? Are you,
I'm not.
Okay, because veterans, through their VA benefits, they can apply for drug plans through there, and that's considered credible coverage, and there's no penalty involved in that. So I wanted to point that out. A lot of people ask me about veterans.
That's right.
Mm-hmm. Yep.
And Ralph, I don't
Well,
think.
you've been very helpful.
Oh,
this
good.
is kind of a hard decision to make and everything, but I think you made it for me. It seems like I think I know what plan I probably want to go on now.
Okay.
I think I'd go knock on wood because you told everybody you don't take in drugs, so you won't have to in the future.
Yeah, really. Yeah. Fingers crossed for you.
Yeah. Good for
And
you.
I don't think any agent can tell you whether you should go Advantage plan or the other one. That's
Right.
going to be totally your
Your
decision.
decision.
Correct. So what I
Right.
do, I just sit down and I do a quick needs analysis. I can tell you quickly if I can help somebody or not. I'm not licensed in your state, by the way, but that's how I work with the clients that are in the states I'm licensed for. And then I just go through, get a really good agent who will go through all the details with you on how the plans work and how they're different. And then you can make a good decision.
Already.
Okay.
Well, I've got an appointment Monday with an agent, so this is really timely. Let me tell you.
Yay.
All right. Well, thank you for
good.
calling in. You got any
So,
snow on
Jerry
the?
and Linda, I'll see you when I get there in April.
All right. Do you have any snow on the ground?
Not yet, but we don't get too much snow out here. Maybe once or twice a year, but man, when it snows, we can get up to 2 foot.
Uh-oh.
Oh boy.
All right. Well, thank you for calling.
Thanks. Bye.
Thank you. Bye-bye.
All right.
That's good.
Yeah.
You know, I like what Kathy Sutter says here. Keep in mind, supplements go up all the time. So yes, they do. Every year you get older, the price of your supplement is going to increase. So, and it will increase again, based on your age and your gender. And then also every year in February of March of every year, the supplement insurance carriers do an analysis on their portfolio that they have in place to do the claims. And they can go up overall 2 to 5%. So when you're searching, you're looking for your supplement carriers, work with your agent to find out what the history has been on overall price increases on supplements. That'll really help you save some money there. And then also if you are in a situation where whether you're married or say you're living, I have clients, they're roommates or their brother and sister. That's considered another person in the household. And you can qualify for household discounts in those situations too.
Okay.
Yeah.
Racer Girl says this is a lot to digest. Thank you for doing it. Racer Girl, you are absolutely right. That's why I said take notes. But remember, this will be archived on YouTube, so you can go back and watch this and pause it anytime you like, and hopefully help yourself out.
Yeah, and you're not alone. I say the biggest value I bring to the table for my clients is I get rid of the confusion. There's a lot to take in. I personally have to do 40 to 50 hours of recertifications every year to stay in this business. So please, there's a lot to know, and I do this every day. So just ask questions. That's the best thing you do. Go into your work with your agent, being informed when you meet with them.
Katrina asks about having
Yeah.
Medicare and having it work with your government GI benefits.
Oh, the veteran is better. How I love this question. This is one of my favorite things to talk about. Okay. So here in the villages, I've been told we have the highest concentration of veterans here in the villages in the whole country. But across the board, across the nation, 1 out of every 5 Medicare beneficiaries are veterans. So as soon as I find out someone's a veteran, I say, did you apply for your VA benefits on va.gov? And because there's so many reasons to do that. Now, here's where it gets a little confusing. I want to clarify this. So you've got Medicare benefits, you've got VA benefits. They work separately. They work side by side. They do not coordinate. So here's a perfect example of how a veteran can use this. I have a client, he's a Vietnam vet, and he was in the Agent Orange era. and he's on about 12 medications. And so I encouraged him, please apply for your VA benefits. He gets the majority of his drugs for free through the VA. And then I help him find a drug plan so that he can get the drugs that are not covered through the VA. That's one way that you can use that. Another quick example that veterans can use, they can have their VA benefits. They could sign up, for example, for a Medicare Advantage plan. And instead of waiting 3 months, I've heard the stories for a hip replacement, you can go through your Medicare Advantage plan and get one a lot quicker. So it's an either or. Again, they do not coordinate. If you start your healthcare going through the VA, you got to finish that. If it's a surgery or something, you got to stay down that path. But if you procure your healthcare through an Advantage plan, you stay down that path. Love talking about the veteran stuff. Yep.
Very good.
Mm-hmm.
What do you see any changes coming up for Medicare?
Yes, there's a bunch. So lots and lots of market disruptions going on in the Medicare space for 2025. You've probably heard of the Inflation Reduction Act. Most people think of that as roads and bridges, but there are Medicare implications in there. And what has happened is, for the first time in the history of our country, since the Part D drug plans were signed in 2003 and rolled out in 2006, the government is going to be able to negotiate prices on the 10 most expensive drugs. And that will go into effect January 1st of 2026. Not next year, but they got to start somewhere. The other thing is that there's a maximum out of pocket on drugs of $2,000. I have clients that are thrilled about this because, especially if you're on expensive medications, that's the maximum amount that you'll pay next year. And if you can't afford to come up with that $2,000 right away, there's a Medicare payment program that someone could utilize as well too. So what does that mean to the insurance carriers? In combination with CMS, with a lot of new guidelines that have come out. Again, CMS regulates the industry. And in addition to that, the insurance carriers are not going to make as much money on their plans as they used to. So they've been doing some things to stay profitable because they have to stay in business too, right? But they're going to get reimbursed less. So what they're doing is some of the Medicare Advantage plans are being pulled out of certain markets across the country. And people should have received their notifications by now that their plan is being discontinued for 2025. It affects a lot of people. Yeah. It does. I've heard anywhere from 1 million to 1.8 million people it's going to affect. The Plan D standalone drug plans, like that Linda and Jerry talked about, that they have to go with their supplement, could see price increases on the monthly premium. And then what the insurance carriers are doing is they're shuffling around the drugs on different tier levels. So any of you out there that are on Medicare, you know that drugs are divided into 5 tiers, right? So that tier 1 drug that maybe you didn't pay anything for this year might be put in a tier 2 or a tier 3. The single most important thing that you do between now and December 7th is look at your drug plans and see what your premium is going to look like. Make sure that your drugs are on the formulary and what tier level. Also know that and I want to be very transparent about this. In part of the process of the insurance carrier saving money, they're not paying insurance agents like me on all the drug plans. I personally don't care. If I find a drug plan that makes sense for my client and it's going to save them money, I say, here's the 800 number you can call, enroll in this plan. Not all insurance agents will do that. So you want to really be very savvy in looking at those plans and whatnot. And that was a very long answer, but that's what's going on next year.
Eileen has a question. And by the way, Eileen, I get you. The insurance, the car insurance, it's crazy high. The homeowner's insurance is high.
Yeah.
Our Medicare doesn't cover eyeglasses. It doesn't cover hearing aids.
Right.
But the coverage is the same state to state, I'm pretty sure. She can talk about it in a second.
Okay, here's the phone call.
Hello there.
You're on the air with Jerry and Linda. Who is it?
Hi, my name is Debbie.
Hi, Debbie.
Hi, Debbie.
And
Hi, Debbie.
I'm calling from Missouri. And I just wanted, she kind of answered the question earlier, but I didn't catch it all. I am 70 years young and I have Medicare A and B in my supplemental insurance, but I don't have a drug plan. And luckily right now I don't take any prescriptions. And she said there's a penalty if you get your drug plan through Medicare. I just wondering if she could give a rough estimate on what it would cost you for your penalty every month.
Yes, actually, there's a very specific formulation on that. So you're 70. So what you're telling me is 5 years you've been without a drug plan, correct?
Yeah, correct.
So that's 60 months. So if you enrolled in a drug plan now, say, because you can do that, it's annual enrollment period. So you can enroll in a drug plan. There is a national average of the monthly premium for drug plans, which right now it's $36.78. What Social Security does is they take 1% of that and multiply it times the number of months that you have not been covered under Part D. So they take that amount, multiply it times 60 months. That's a very rough estimate of what you should expect your monthly penalty to be. And so, but you will need to get that specific number from Social Security, who manages Medicare. Okay. But I just wanted to give you a ballpark estimate just so you know what to expect.
Yeah. Okay. Well, I'll just go on my Medicare thing on the internet and see what I can find out then.
Well, you don't sound a day over 25 on the phone.
Yeah, you're like a spring chicken there in Missouri. Yeah.
Well, bless your heart. No.
Well, thanks for calling.
All right.
Bye-bye.
Thanks a lot,
Okay.
guys.
Bye.
She didn't turn down her monitor.
She did not.
I could hear it back there.
I could hear it too. Yeah.
That happened.
It happens.
Yeah. So no hearing aids, right? With Medicare.
No, not under it.
No glasses.
Unless you've had a medical condition of the eye.
Okay.
So a most common thing is cataract surgeries.
No glasses.
You get one pair of glasses for
No.
cataract surgery.
Oh, but for cataract. And what about dental?
No dental under original Medicare. No, no. But that's why some people like the Advantage plans, because there's dental, vision, and hearing coverage in those. So it's a trade-off between the two, what fits your needs, and knowing there is some flexibility down the road to make some changes.
Now that dental and vision and stuff in the Advantage plans, it's kind of shabby, isn't it?
You know what? When they first came out, the networks were not very populated because, again, remember with Advantage plans, it's all network driven. So, but some of the carriers have really upped their game on signing up doctors in those networks. So there's more choices now than there used to be. And there, about 3 years ago, the benefits really bumped up quite a bit on the dental portion and the Advantage plans. But now, with carriers getting reimbursed less, you're going to see maybe those benefits go down because they got to transfer that money into covering the drugs to stay compliant. So it's a shuffle game, kind of.
You are on the air with Jerry and Linda and Renee. Who's calling?
This is Alfonso from Colorado. How are you?
Hey, Alfonso, we're doing great.
Watching you guys live on YouTube and I think you heard me before. I'm legally blind and
Okay.
I got Medicare and Medicaid.
Okay.
Now I have a question. Pick up this election. I heard that Donald Trump's going to get rid of Medicare, Medicaid, and Social Security, where there can be nothing.
Yes, we all hear that too. I don't go into any political discussions on any of my meetings because I'm not allowed to. However, I will say this. We don't know what's going to happen yet. And I wish I could give you an answer what's going to happen. We just have to really wait and see until the new president gets sworn in January 20th and see what him and his administration want to do. So any information I'm giving you right now is current information on how the plans work. Now, you are on Medicare, Medicaid, which means you're dual eligible, correct? And so,
yes.
So what I really would suggest that you do is look at the dual eligible plans in your area, find an agent that can work with you on that. I heard you say you're legally blind, so you'll need somebody to
Yes.
help you navigate the system and find you a plan, maybe with some additional benefits for next year. Because the plans will stay in place. The carriers have to file their plans by August of the previous year, and those plans are in place and will stay in place from January 1st through December 31st of next year. Okay, so that gives you a little, maybe a little comfort knowing what's going on that way too.
Alfonso, I'm not an expert, but I'm not a spring chicken either. I think you're going to be just fine. Don't worry so much. Don't worry about you. Trump was president 2016 to 20. Did you lose any benefits then?
Yeah, I had a reduction on my social
You
security.
did?
Did you? Okay.
Well, we didn't, but just relax and try to enjoy life. And
And my Medicaid was partially cut off too.
huh?
Okay.
And you live in Colorado. Is that anything to do with Colorado?
Well, I lived in New Mexico at the time, but I just moved to Colorado in 2018.
Yeah, I don't know, but I just want you to relax and don't make it any worse on yourself, and you'll probably be just fine.
Because I'm only 40,
Oh, you're only 40.
Oh, you're really young. Wow.
Same
Okay.
as your guys' age.
Yeah, same as
that's-
Linda.
I just turned 40 myself.
Me too.
Sure.
29 here.
Yeah. Oh,
Wow.
wow. Yeah.
Well, I hope you're all right, and you take care. And thanks for watching us. Or I guess you're not watching; you're listening.
Medicare, Medicaid is different. It varies from state to state. Like some,
Yes, it
like
does.
in Colorado,
Yes, it does.
the
So
coverage is different from there. Like in some states, Medicaid does cover glasses, and in some states they don't.
correct. So this is the best way to answer your questions. Medicare is a federal program. Medicaid is a state program. You probably already know that. And Medicaid can, vary from state to state. Absolutely.
But
Whereas
Medicare can also vary from state to state as well, too, right?
Medicaid can vary by state to state, but you make a good point on the Medicare side, because the Medicare Advantage plans, if you're dual eligible, that can vary by county to county.
Wow.
Yeah, so because they're filed by county. So that's why it's real important to look at find a good agent in your area that will work with you and find a plan that'll be compatible with what you need next year. And again, have that assurance of knowing the plans will be effective January 1st through December 31st, so that you get that coverage. Okay.
All right.
Thank you, Alfonso.
Thank you.
Take care.
Thanks for calling in.
Yeah. You too. Bye-bye.
Bye. Alfonso mentioned he's 40, and I want to just mention something is that most people think, 65 is Medicare age, right? I have clients in their 40s, and because in Alfonso's situation, he shared that he's blind, so that would have qualified him, I'm guessing, for Social Security disability income. And once somebody's on Social Security disability income for 24 months, they're automatically enrolled into Medicare. So just so you know. And then when they turn 65, again, so Alfonso, if you're still listening, when you turn 65, you'll have another opportunity. Your guarantee issue window will open up at age 65. So you get, in your case, you had 2 opportunities to pick whatever you wanted.
That's good.
Mm-hmm.
Good advice.
Mm-hmm. Yeah. I won't be doing this in 25 years, but I'll have to find somebody else to help.
It goes fast.
It
Sherry-
goes way too fast. I'm
Sherry
telling you.
says the Advantage plan coverage is not shabby. I just went by, those add-on plans that they offer us. The coverage is small, I think, for the amount of premium that you're paying. Not talking about Medicare, but when you get all these offers in the mail to get dental plans
you get a
and
ton
vision
of them.
plans. Yeah.
Yeah, the dental vision hearing piece is tricky if you don't go on an Advantage plan. I'm going through that myself right now. So here's what I advise my clients, especially when you turn 65 coming off of a group employer plan, reach out to your HR department and see if you can go on COBRA just for your dental and vision. And that will save you some money there too. So, because the dental vision hearing plans are not cheap. And so a group plan, if you can do the COBRA on that, might save you some, $30, $40 a month, something like that.
That's good advice.
Mm-hmm.
Hey, time flies when you're having fun.
It does. So thank you so much for having me here today.
We're an hour in, and
Oh,
yeah.
man.
Renee, you've been a wealth of information. I think
Yes.
that we just scratched the surface, though.
Yeah, there's a lot, but very, very good questions
Yeah.
from your audience. And I was impressed. They're from all over the country.
They are.
Yeah.
Now, these
Yeah.
questions will be available later when you look at the video. You want to take one more?
Sure, we'll take one more.
We'll take one more question. You are on the air with Jerry and Linda and Renee. Who's calling?
Hello, this is Sally from Prosser, Washington in Washington State.
Hi,
And
Sally.
I know it's a dumb question. Hi. I know it's a dumb question, but I still wanted to ask it anyway. Do you think Trump is going to be cutting the Medicare program?
We don't know. I mean, he's still putting together his cabinet and all of that. And somebody asked this earlier. I don't know. You hear all kinds of rumors. So
I don't think he is, but who am I? I mean, hey, I'm just the host.
yeah,
I have no idea. I listen to all the candidates, Democrat, Republican, Bobby Kennedy, and they all swore to keep it good for retirees. So I'm taking them at their word.
Yeah, okay.
And in the villages, we got a lot of voters. We have a lot of voters here,
We got 100,
and most of them are on Social Security and
Yeah.
Medicare.
Yeah, yay,
So-
Medicare. Okay.
You take away that Medicare, you're going to lose a lot of votes.
67 million votes to be exact.
Yeah.
Yeah.
Thank you for calling in.
All right. Bye-bye.
Bye.
All right. That's going to do it for us. Listen, we want to thank Renee so much for coming in. I think we've got enough meat left on that bone to do another show sometime, but you'll be able to access all these questions from your home.
Oh, I can.
So you can go through and you can see all the questions
Okay.
and
the
look at
comments and
those.
stuff.
Yeah.
Okay.
So it's been great. And I want to thank every one of you for tuning in. We appreciate you all so much.
Thank you. Thanks for the questions.
If you liked our video today, press that like and subscribe button and share it with all your friends. Until next time.
See you when you get here.
We didn't coach you on that,
I
did we?
forgot.
We
And
forgot
I
to-
should know. I watched your
we
show.
forgot to coach